Hey everyone, Dr. Hanisha here. Thank you so much for joining me on season 2 of my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it only makes sense to have the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I see patients and clients all over the world virtually, so make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. All right, let's talk about the episode for today. So for today's episode, I actually had the opportunity to interview a friend and esteemed colleague of mine, Dr. Devin Miles. We talk all about the kidney. We talk about kidney diseases, the risk factors of those, the common diseases that we see, how food can affect your risk of kidney disease, and how to prevent the need for dialysis, and so much more. Dr. Devin Miles provides natural solutions for prevention, gastrointestinal disorders, and kidney disease. She uses herbal medicine, homeopathy, hydrotherapy, environmental changes, and nutrition to help her clients achieve the results they are looking for. She graduated from Southwest College of Naturopathic Medicine, a 4-year curriculum designed to train naturopathic physicians how to blend conventional and natural medicine to achieve optimal results. Dr. Miles naturally addressed her own health challenges at the time and discovered she wanted to do the same for others. She aims to prevent and reverse chronic illness and helps individuals achieve a higher state of health. Dr. Miles has helped clients improve their digestion, mood, and energy, normalize blood pressure, bring blood sugar back to normal from pre-diabetes range, reduce chronic pain, eliminate kidney stone formation, stabilize kidney function, and lose weight. She is the owner of It's Time Natural Health and offers telehealth consultations right now. So this episode is really for anyone trying to optimize their health, but definitely for those who have a family history of any kidney disease. Natural medicine is extremely powerful and can help prevent a lot of kidney diseases. So if you know someone with a kidney disease, then send this episode over to them so that they can feel more empowered about their health. All right, well, let's get straight to the episode. Make sure to rate and review the podcast and let us know what you thought of the episode, and reach out to Dr. Miles or myself after the show. All right, enjoy. Hello, Dr. Miles. How are you doing today?
I'm good. How are you, Dr. Patel?
I am doing well. It's so good to meet you officially and have you on the show.
Likewise, I'm really happy to meet you as well.
Yes. Okay. So let's get directly into the interview. This is the first question I ask all my guests because we all have such unique stories. So tell me about your journey. How did you get involved in naturopathic medicine?
So I started having digestive issues at 21 years old. It started off as constipation and then gas, more gas, foul, it started to get foul gas, and then I started having one food sensitivity after another. Fast forward, I got diagnosed with irritable bowel syndrome. Didn't have too many solutions with the two gastroenterologists that I saw, and so I went into a health food store that one of my family members found on my block that I had never seen before, and the owner had IBS, and so he was the first person to really give me hope, to really give me some solutions about what to do. So that was the beginning of me taking care of my own health from a natural perspective, starting to research it like I have not researched anything, and realizing that I liked it. So I started looking up different career fields and found naturopathic medicine, and I was like, that's it. That's what I want to do. Because I looked at it and I was like, this is very comprehensive. And I knew from my own body that I needed more than just one thing. So when I saw this, I was like, yeah, I like this.
Yeah, this is it.
And that was, I went into it with the goal of reversing chronic illness and preventing it in the first place, because I just felt like there were just so many things people that we're dealing with here in the US particularly that they could be prevented, and so that is why for me, when I tell people my focus is, I always include prevention in that, because I want people to know I'm not here just for sickness. I'm here also for prevention.
Right, right. Yeah, prevention is the best medicine, right? And I don't know when everyone's going to be listening to this episode, but right now we're going through the COVID pandemic, and Trevor Noah, he said on the Daily Show, he said something about how prevention is boring, but it's effective, right? So it's not as
Yeah,
exciting to talk about
right.
prevention like as it is to talk about like the different types of surgical procedures and things we could possibly do with like all the new technology, but like preventing that heart attack is effective, right? And
Yeah.
so he wasn't talking about that specifically. He was talking about like the measures in COVID. But I was like, that's a great point. Like you're exactly right. Like prevention can be boring, but it is effective. It is
Mm-hmm.
definitely
Mm-hmm.
effective.
Yeah, I think we're in a very high stimulus type of environment. We want stimuli all the time. We don't, and as human beings, we don't always value things that we haven't connected to, if you will. When you have an illness, it's like you've connected to something, you have an incentive to do something about it, and you see the difference. You feel the difference between when you have, a chronic ailment versus when you don't have it, and you see what you had to do to get away from that chronic ailment, right? So I think there's more of a connection, more of an incentive, more of a stimulus, if you will. But with prevention, it's like, if you don't feel anything and then somebody's telling you to do something so that you keep not feeling anything, it's it's an interesting conversation to have. But I think if you're able to learn through observation and learn through education in general, that can be your incentive.
Definitely, definitely. And I mean, things as simple as like aging can be just like a quick indicator of where, or like, when people start to feel joint pain or back pain or something,
Right,
like that's
right.
already, and that those are signs, right? That we can work on preventing that from either getting worse or even reversing it too. And so, yeah, I completely agree. I love it.
Yeah, and sometimes people think they're healthy and then they come in, because I do see some clients for prevention, and they feel good, nothing's wrong, but then there's certain habits that are not the best for them long term, right? And so it helps you to really pinpoint as a doctor, like you can help them to see where they can be better, right? And then sometimes people don't feel anything, but like when they first come in, they're like, I'm good. But when you start to work with them, they may get to a better state of health than they've ever been. And so they go from thinking they're fine to like, oh, I'm even better than I was before.
Right.
And
Yeah.
so that can also be an amazing, I think, discovery for one. If you're looking into prevention, you're like, do I really need this right now? I mean, yeah, you don't always know what you don't know about how you can feel, and how even maybe even your cognitive function could be better, or something simple for you. Something simple as sleep might be like, whatever. And then I help you to sleep better, and you're just like, wow, this is great. So
Right. Yeah.
different things like that can make a difference in someone's life day to day, and in someone's life for the long term.
Long term for sure. And yeah, and that goes into the optimizing, right, and experiencing Mahan or great health in general. So okay, so let's get into the main topic for today. So what drew your interest? So we're going to be talking about kidney diseases and all sorts of kidney disease. So what drew your interest towards kidney diseases specifically?
So in towards the end of naturopathic medical school, I had realized, I think I want to do more of niches. I want a few focuses. And so when I was thinking about that, my urology teacher was talking to us about kidney disease and, as he called it, naturopathic nephrology. And he was very much encouraging us to consider that as a niche. And so I decided to just take him up on it. And my dad also has kidney disease. So I have more of an incentive, if you will, to really understand how to help people heal from kidney disease, or help them at least to have a much better quality of life. And so where I am now is I am able to help people improve kidney function, at least keep it where it's at, so that they can have that better quality of life, and potentially avoid dialysis.
Yeah, definitely. And I think that's so, so important. So let's get into that. So first of all, what would I feel like people don't know much about kidneys in general and like what they do. So can you explain to us the physiological function of the kidney and what it's naturally or intended to do?
Sure. So I'd like to first talk about, a lot of times in the holistic world, we hear this word detox, and a lot of times when you see detox protocols or detox products, it's usually not only addressing the colon and the liver, but a lot of times they'll also address the kidneys, so they make you pee more, right, or urinate more. The kidneys is actually one source of being able to cleanse your system out. So it helps to remove waste products from the body. It balances the body's fluids. The kidneys filter and return to the bloodstream about 200 quarts of fluid every 24 hours, and about 2 quarts of that goes out in the form of urine. It helps to regulate your electrolytes, such as sodium and potassium. And so it helps to filter as well as reabsorb. So it helps to also regulate the release of the hormone renin to control blood pressure. Produces an active form of vitamin D that helps to regulate strong, healthy bones, controls the production of red blood cells. So it does this through erythropoietin, which is a hormone produced by it's called juxtaglomerular cells, in response to a decreased red blood cell count. So the erythropoietin will stimulate the bone marrow to increase the rate of red blood cell production. It also regulates the pH of the body by removing excess acid or base from the fluids of the body.
Yeah. I mean, okay, so it's so crazy because you just mentioned so many different things that the kidney helps to do. And so often in our world today, because we love to specialize and like disconnect things, but that just shows like, okay, so the kidney works with your red blood cells. So if you have issues with your circulation, it helps. Renin helps to balance your blood pressure. If you have blood pressure issues, that's going to affect your kidney. If you have low vitamin D, that's going to affect your kidney, right? Like it's like realizing these things is so important, because I think often we're like, oh, like I have high blood pressure and or I have low vitamin D, and so I just need to, I don't know, go out in the sun more. And it's like, no, there are a lot of impacts of having, I mean, and there's a difference, of course, we can get into that with low vitamin D or insufficient vitamin D.
Yeah.
And but still, like I just love like how you just broke down all the different things and like the way it impacts all the other parts of your body, because it does.
Yeah, definitely. The body is very much connected. And that was one thing that I knew going into when I took the time after school to study nephrology from a naturopathic perspective.
Mm-hmm.
And that was one thing I figured that I took into that education with me, is that I was looking to see how the body was connected to the kidneys, because that was something in naturopathic medical school you just learned all the time. The body's connected. And then you have these different things that you do specifically for whatever the issue is, right? But again, as I was learning, I still saw that, that the kidneys are very much connected to the body, and how you are able to help the body is also in certain ways how you can help the kidneys.
Mm-hmm.
Yeah.
Definitely. So yeah, let's then talk about if there's an imbalance then. What are some of the most common kidney diseases that you see in your practice in general?
So then the number one is it's called chronic kidney disease. And so the top two reasons that people get chronic kidney disease in the United States is hypertension and diabetes. So in that situation, you can have just kidney damage. You're not filtering properly, and so you can also have different symptoms based off of having kidney disease. And also when it starts to get really bad, you're not having good balance again with your electrolytes. And so that's why a renal dietitian can be really helpful to help you balance out your diet, so that you're not taking in too much of a certain mineral that you can't clear out anymore, right? So that could be, something like you have too much potassium. That could be an issue for the heart if you have too much potassium. So that's like the number one. There's also glomerular nephritis. That can be inflammation to the kidneys. And sometimes that can happen suddenly after strep throat. It can be an acute thing and then go away. Other times it stays around longer. It can be more chronic. There's also polycystic kidney disease, and that is the most common inherited kidney disease. And that's characterized by cyst formation on the kidneys, and that could also cause kidney damage, right? So if you have kidney damage, and that could also eventually cause kidney failure. When you have kidney damage, that is not something chronically. If you're having it chronically, right, that's not something that is considered reversible by modern medicine. And so that's why you see people just continue to have kidney disease and eventually progress on to dialysis, because there's not a per se solution for that once it's in like this chronic state. So that is where I come in as a naturopathic doctor saying, yes, there are things that you can do to definitely further stall damage and prevent damage in general, and to see some improvement in the kidney function. In addition to just general kidney disease, there's also kidney stones. If you have untreated urinary tract infections, that could go back further up into the kidneys. So it's like the kidneys and then the uriners and the urinary bladder, all these things are connected. So if you're having a bacteria that's sitting in the bladder, and then it can travel back up to the kidneys and cause kidney damage. So that's in a case where somebody's just really not, treating their UTIs. And there's also congenital diseases where there can be a backflow of urine into the kidneys again. Various medications, particularly non-steroidal anti-inflammatories. If you're taking high doses for a long period of time, that can damage the kidneys. Recreational drugs like heroin and crack can also damage the kidneys, and other different toxins are shown to be part of that. And there's a difference between, in the US, we know more about chronic kidney disease. But there's also something called chronic kidney disease of non-traditional origin, and that's CKD-NT. So that occurs mostly in communities around the world where heavy labor is common, and it's not associated with diabetes or hypertension. So there's a couple organizations that are constantly looking into this, trying to figure out where the cause of this is coming from. So I was just recently on their website, and so mainly what they're pushing, they're looking into different toxins, different heavy metals and things like that as well. But one of the more common things that's seeming to come out of their studies is heat stress. So it's a lot of heat, a lot of strenuous work without access to water, shade, and rest. So of course, if you are not drinking enough water, that can be pretty hard on the kidneys.
Yeah, let's talk about water a little bit more, because I feel like that is something I find surprising, because I love water so much. But I've found that a lot of my patients, friends, family members, people around me do not really like to drink water, or don't drink enough water,
Right.
usually. So can you talk about how that can affect your health a little bit more?
So every cell in the entire body needs water to function.
Right.
And it's part of the processes that it needs to get nutrition in, move toxins out. I've noticed even in the past, sometimes when I wasn't drinking enough water, again, my digestive system wasn't working that well. My joints may have been hurting a little bit more. And when I would think about what I was doing wrong, because sometimes it's like, it would take me a moment to like pinpoint what it was. A lot of times my body would react fast, like because it was like certain foods that I could tell were being part of the problem. But then there were other times I was just kind of like, what am I doing wrong? I can't figure it out. And then it would hit me. I wasn't drinking enough water at that time. So I was just start drinking a bunch of water and things would get better.
Mm-hmm.
And so that would be like one of the big things I would tell people: if things are not working right, in addition to like seeing a naturopathic doctor, that is one thing. That's one of the first things that I try to get people to do is drink more water. And so yes, from the standpoint of the kidneys,
Mm-hmm.
That is what the kidneys are doing. They're filtering the fluids, right? They're balancing them out, and they are filtering out various toxins and waste. So when we talk about kidney stones, that is one way to prevent them, is that you have enough water. Because if you don't have enough water and you have too much, especially if you have like some predisposition for whatever reason to getting kidney stones, having enough water increases the solubility of those things. So essentially they're able to pass through and not clump and form a stone. And so that's why water can be super important for the kidneys as well.
Definitely. And without like getting on this topic too much, I've just also noticed a lot of people will drink LaCroix or sparkling water and think that, you know, it's the same thing. And I don't think it is. Would you happen to know much about the difference and how that works in our body?
I actually can't answer that question, but I would just, I wouldn't say drink like 64 ounces of carbonated water every day. Like that doesn't make a lot of sense to me.
Yeah,
I
definitely.
think you need, I mean, if you look at nature, right? Nature does not have, as far as I know, most of the water that we see on Earth is not carbonated, gas water, right? So you kind of have to look at it from that standpoint too. Does nature mimic what you're trying to do? And in that case, as far as I know, the answer is no. So having just pure water, I think, is much better for the kidneys. I mean, carbonated water can be helpful when it comes to digestive issues, but I just wouldn't use it as like your water all the time.
Right. Yeah. Okay. I appreciate that. I really like that response with like, does it happen in nature? Because it does not. At least, again, from my knowledge either. I don't know of that being a thing in nature. Yeah. Okay. And then some of the other things that you talked about that could increase your risk of kidney diseases in general, everything else that you mentioned, some of them were like recreational drugs like crack and heroin. And then we talked about diet a little bit, but I actually am a little bit more curious about alcohol because again, like crack and heroin, cocaine, all of these drugs are illegal, and technically like we know that they're bad, but alcohol is something that we consume as a society regularly.
Mm-hmm. Well, the main thing, I mean, when I look at risk factors, that one I don't see come up as much as diabetes, hypertension, heart disease, family history of it, over 60 years old, obese, and smoking actually can be a risk factor. The smoking can very much be constrictive of the blood vessels, and the kidney has a lot of different blood vessels, of course. And then the cardiovascular system in general can affect the kidney. So if you have high blood pressure, that can come either from the kidneys or from somewhere else. But in any case, if you have high blood pressure, that can be very taxing on the kidneys. But what I will say about alcohol is that it's dehydrating. So kind of going back to what we said before about water being so important for the kidneys, you have to hydrate yourself effectively if you're somebody who is a regular drinker. The same can be said for coffee as well. Coffee is a diuretic. So diuretic means that it's pulling water out of the system. That's why you have to urinate more when you drink coffee. So that would be the main thing that I would say about alcohol at this point. I mean, of course, alcohol is toxic in general to the system. It's not per se, I mean, every once in a while you hear about different remedies, of course, that can be used with alcohol, but that's not like 8 ounces worth of alcohol, right? It's like a little shot of something with some herbs maybe, or something very strong to clear your sinuses, right? But if you're having like 8 ounces of alcohol, I mean, that's, your body's not happy about that. So I would definitely say that the kidneys are not happy about it either, if for no other reason, definitely from the hydration standpoint.
Definitely. Okay, I appreciate that. Okay, so moving on from some of like the risk factors of kidney disease, let's talk about kind of the end stage, right? So with dialysis, that is something, again, that we hear about a lot, but I don't think many people really know what dialysis is. So can you explain what that is and at what point a patient might actually need it?
So there's 5 stages of kidney disease, and these are some symptoms that I'd like to say may be indicative of you having kidney disease. So there can be fatigue, weakness, feeling cold, shortness of breath, trouble thinking clearly, swelling in the hands and feet, feeling itchy, darkening discoloration of the lower legs, swollen or puffy face, foamy urine, trouble sleeping, feeling the need to urinate more often, as well as muscle cramping due to electrolyte imbalances such as calcium or phosphorus. So if, of course, you're having a collection of all those symptoms, this would be a good time to really start working with a nephrologist. Like, don't just let these things just keep happening. But with all that said, you could have no symptoms whatsoever. So kind of like hypertension being this silent killer, kidney disease can be quite silent. But one of the ways of it's kind of, again, the same with hypertension, you can measure it. You can see what's going on through different lab markers. So kidney disease has 5 stages, and um, around stage 4, stage 5 is when a nephrologist is going to start talking to you about dialysis, because you're getting to the point that the kidneys are not filtering effectively. That has to happen for you to survive, because if the kidneys do not filter effectively, you're going to have waste products just building up in your body, and that's just toxins just sitting there. It could be an overload of toxins, and so that's why dialysis is needed. So dialysis helps your body to get rid of waste and extra fluids in your blood. So it takes the place of the kidneys. It doesn't do as great a job as kidneys would, but it is a very life-saving alternative if your kidneys are not functioning well. I mean, again, as I mentioned before, I have worked with clients who are at stage 4, and they're still doing fine without dialysis, but it is something, at that point, it is something you have to be very much on top of if you're going to stay off of dialysis. It's not like you can just fall off for a month and then come back on. It's a regular, like dialysis is a regular thing. Managing your kidneys and keeping them where they are, or seeing some improvement, is a regular thing that you would have to be implementing.
Yeah, definitely. I mean, if at any stage, if you want to halt the progression of the disease, then I think it's, like, you do have to manage it. So if you don't want it to progress beyond even stage 1, then you really got to work to manage that. And it's not, obviously at stage 4, it is a little bit more intense, but I think it's important to note that, like, I mean, if you're not monitoring it and not managing it properly, then it can lead to that state, that level of needing that dialysis.
Yeah, and that's something that I try to advocate for now is prevention of kidney disease. And so one of the things that I have offered is a free ebook, which I can send you the link to later. So essentially, you sign up for the email list, you get the free ebook that shows you how to monitor your own kidney function, because I have gotten a lot of calls from people who are at stage 4, stage 5, and it was just like, where were you at stage 1? Like, why didn't you call me earlier? But what I find out is that they find out that they're at stage 4. They didn't know when they were at stage 1, stage 2, stage 3. There is some disconnect going on between the physicians and the patients. In terms of the communication about where they stand and what they can do. And I think a lot of that has to do with just the fact that the only solution per se is dialysis at a certain point. It's not like you
conventional medicine.
The kidney function. Yeah, right.
Yeah,
in conventional medicine.
Yeah.
Of course, if there's some pre-existing condition like hypertension and diabetes, this is why doctors are going to particularly be on you about managing the hypertension. It's not just from a cardiovascular standpoint, but it's also from the standpoint of protecting your kidneys. And I don't know if it's like people, I think, know that their kidneys could be affected, but they're not like fully on top of it. And so that's why I try to also create that sense of, you need to be on top of your kidneys if you have hypertension. You need to be on top of the hypertension, because we want to protect your kidneys. So in addition to helping people with kidney disease, I also help people with pre-existing conditions or different risk factors like hypertension and diabetes. So in addition to helping them with those conditions, I will also implement things to help to protect the kidneys at the same time. A lot of the studies that are out there for different herbs and foods, they're doing studies that show amelioration of something. So they created kidney disease, and then they implemented something to help to test to see if it would help to reduce the amount of damage that was done. And that is something that I implement, is those things to help prevent damage from happening in the first place.
Yeah. Oh, that's really cool. Yeah. So let's talk about what you do a little bit more. What is, I know you just mentioned you do use some herbal remedies and like focus on prevention of like hypertension, diabetes, or reversing those and managing those so that we don't end up with end stage kidney disease. But what are some other things that you do in your practice?
Sure. So the main theme that I want to make sure everyone knows is that antioxidants can be very, very helpful for the kidneys. It helps to prevent free radical damage, and it's this per se tag team effort between antioxidants and reducing inflammation. If you have inflammation, you have more free radicals. If you have more free radicals, you can have more inflammation. And so to reduce free radicals by using antioxidants, you're helping to prevent damage to the kidneys, and by reducing the inflammation, you also reduce the free radicals. So they both can. I want to help to reduce both at the same time. Improve the antioxidants and reduce inflammation. So one of the ways that can be helpful is through something like flax seeds. Flax seeds are very anti-inflammatory, but there was a study done where patients were given flax seeds, and they found that 30 grams of flax seeds per day was well tolerated, and there was some benefit in terms of their renal function. So they saw reduced serum creatinine, which is a common marker to look at for kidney disease. They saw reduced protein in the urine, and they also saw reduction of complement C3. So another thing that we hadn't discussed yet that's also a risk factor for kidney disease is lupus. And so having something that helps to reduce complement C3 can be helpful in that regard. So yeah, the 30 grams of flaxseed daily confer benefit in terms of kidney function, as well as inflammatory markers, also help to reduce cholesterol. So it was helpful, particularly in this case for lupus nephritis. So that's what people with lupus may have in terms of kidney function.
Just to clarify,
another one,
30 grams of flax seeds?
30 grams of flax seeds.
Yeah.
So another one that, an herb that can be very helpful for the kidneys is milk thistle. And we hear about milk thistle all the time from the standpoint of the liver. But it also helps the kidneys. The regenerative property that it can do for the liver is the same regenerative property that it can do for the kidneys. So when we talk about, one thing that I love about herbs is that you can see how they do so many different things. It's not like there's just one thing that they do. So in that light, milk thistle helps to reduce blood glucose, reduce HbA1c, helps reduce serum creatinine, reduce uric acid, which is another buildup of a toxin buildup that can happen, particularly with people with kidney disease or gout. It also helps to reduce the urine volume. It can be good for kidney regeneration, and milk thistle itself is an antioxidant. So it can be really, it's a really nice herb that I use often for people with kidney disease or people who are at risk for kidney disease.
I'm excited because I put milk thistle in my tea every day, so I feel better about it.
Yeah. It's a very nice herb. I think that's why it's gained so much popularity, because it's just an overall really nice protective herb and supportive herb. So yeah. And then the other one that I wanted to mention was cordyceps, which is more of a fungus, not an herb. But it helps to reduce blood urea nitrogen, which is another marker that's commonly looked at for kidney disease. And it helps to reduce the blood urea nitrogen, also known as BUN, creatinine, and again, urinary protein. So as we talked about before, with kidney disease, one of the things that can happen is that you see protein in the urine. You're not supposed to see protein on a urinalysis. That's where they would see it. So that could be an indication that your kidneys are not filtering correctly, or they're letting too many things come out, right? So cordyceps helps to improve the immune system. It helps to improve anemia. Again, it can be good for kidney regeneration. Helps deal with stress and thus reduces the blood sugar. And yeah, it may in fact help to balance out testosterone as well. So I really find cordyceps to be a wonderful fungus. I want to say herb, but it's a fungus.
Yeah. Yeah, definitely. I mean, I think cordyceps is another one that I feel like has become very popular, right? And it's funny to talk about herbs being popular because obviously they've been around for thousands of, I mean, way
Right.
thousands of years, but have
Right.
used as medicine for thousands of years. Um, and same with fungus, right? Like mushrooms, they've all been used, but cordyceps has become a little bit more popular, I think, in our culture and our, I guess, current culture. And I feel like I hear it so much in terms of like brain, like cognitive functioning and stuff like that. And I mean, I think it's important to again note like how everything is so connected, and that's again why I love herbs and mushrooms and all of our plant medicines so much, because they work on everything. And so whenever you're helping lower your blood sugar with the cordyceps, or like helping with blood flow and circulation, like that's also helping your brain too. And so it's just like there's like so many different effects to it, and that's why it's so cool. I just love it.
Yeah, and before even with brain function, I knew cordyceps to be more of an adaptogen. And so that's actually the way that I used it in medical school, because my adrenal function was taking a hit in medical school. So cordyceps was very helpful for me at that time as well. It's a nice builder. You know, when you feel weak, it can really just build you back up.
Yeah, definitely. I actually did an episode all about adaptogens. So if you're interested in learning more, whoever's listening, definitely go check that episode out. But yeah, because adaptogens are so powerful and so helpful, like you said, with lowering stress. And yeah, I was definitely taking a lot of adaptogens in medical school and still taking some, right? Like I think,
Right.
yeah, I feel like in the world we live in, we just need them. You know?
Yeah. Actually, I had a client recently. She went through grad school, and so it was a lot on her system, and she had different symptoms dealing with adrenal function. And so recently, some of those symptoms like came back, and they hadn't been there for years, but she had gone through like three rounds of different infections. And so I was like, well, it sounds like your body just had a lot to deal with, and the kidneys, excuse me, the adrenals had a tall order essentially, and so it was just a lot. So really, right now, I think what you need is more adrenal support to just help your body to better recover from what just happened. Mm-hmm. So sometimes, yeah, I mean, even now with me, I'm much better off than I was in medical school. But every once in a while, I'll see like that per se creep up of some symptoms I had back then, and it's like, okay, yep, need to build myself up.
Definitely. Yeah, it's a constant work on like bringing ourselves back to balance and homeostasis all the time. Like it doesn't end, but it's also exciting that like we're always working on ourselves and improving. It's not like meant to be a negative thing. I think it's like an exciting thing.
Yeah, it's empowering just to know what to do.
Yeah.
I mean, that's what I offer my clients. Is like, sometimes when you have certain things going on, it can be a powerless feeling, or a hopeless feeling when you don't know what to do. And then I show you what to do. And for me, that has been something that I'm very grateful for, that I've learned through naturopathic medicine.
Yes. Oh, that's awesome. Yeah. Okay, so before we move on to the rapid fire questions, I know you talked about your book, which we will definitely put that link in the show notes below. So so make sure to check that out. But do you have any other resources that you recommend our listeners go to for other resources, or anything else that you would like to recommend?
Well, I think the kidney.org, which is the National Kidney Foundation, is really a wealth of resources, wealth of knowledge for people with kidney disease, or just anyone who wants to learn more about it, including different risk factors. The DaVita Dialysis website also has some good information. Like they have a piece on the benefits of being on a vegetarian diet with kidney disease. And so they talk about the plant sources have been shown to decrease protein in the urine, slow decline of GFR, which is one of the major lab indicators to look at kidney function, result in less kidney tissue damage when compared to animal proteins, reduce kidney cyst growth, improve the lipid profile of the blood. And so when I was looking at that, I was like, oh, this, this website has some nice information. So kidney.org for the National Kidney Foundation and the DaVita dialysis website, I think, are some nice resources just overall for kidney function.
Okay.
But yeah, I mean, even with that said, like with my clients, if I don't put them on a vegan diet, it'll just be more reduced animal protein. So like I wouldn't want you just eating meat all the time because the kidneys just can't deal with that at a certain point.
Yeah, definitely. And the reality is meat isn't necessarily inherently bad, but the standard American diet, we consume way too much meat and then also poor quality meat. And so, so getting away from all of that is going to be best.
Yes, that's a big deal as well as the quality. I have one client, if he eats regular beef, he just gets this, the major itis and like falls asleep. Versus if it's grass-fed beef, that doesn't happen.
Wow.
So I see, major shifts like that when people do actually eat good quality food.
Oh, yeah. It's crazy. Food is medicine, right? Okay, let's go into the rapid fire questions. So these are questions I ask all my guests. You don't have to answer them rapidly, but you just answer them as you please. So the first question is, what does Mahan Health mean to you?
Thriving physically. And for me, I grew up an athlete, so I mean that to a pretty high level. Feeling great, having clarity in your mind, having balance, having peace and joy within, and also having fun and enthusiasm. Just all of that at the same time.
Yes. I love that. Okay, so these next two, they could be connected. They don't have to, but you can answer them however you'd like. What was the most difficult health change for you to make personally, and what are you still working on?
So the most difficult health change was being okay with not eating what I used to eat and being okay with not eating what everyone else still eats. That took me years to get over. There's some people who can just go cold turkey and it's fine. For me, I had a journey, and I'm glad I'm on the other side of that now. Something that I'm still working on changing, I think like most people, sometimes I might eat a little too much, and that is something I have to make sure I balance that out. And I'm like, okay, I have to stop here.
Yes. Yeah. Well, thank you for sharing, because I feel like a lot of people both can relate to both of those things, right? I definitely could relate to the diet, like changing the diet because everyone else wasn't eating the way I was eating, right? And food is so social that it does become very difficult, and then that affects our mental health. And so there's this balance of like, okay, just like being okay with that situation and understanding we're doing what's best for our bodies. For sure. Yeah.
And even though it was tough, like I was able to help my family because of the things that I've learned. And so they're in a better position because of what I had to go through.
Right.
So
yeah,
it makes it worth it.
Yeah. And we can have a ripple effect of, empowering and changing lives through health and wellness.
Right. Definitely.
Yeah, definitely. Okay. So my last question is, if you could have any commercial, like a PSA on health, what would it be about and why?
A call to monitor your own kidney function, because I see this gap happening, and I would rather people call me prior to having kidney disease in the first place, or have, finding out they're at stage 1, right? And knowing what that means. So it's more like just this collective effort to be proactive about monitoring your kidneys, just as much as you monitor, other things, right? So that would be my thing. And that's what my ebook goes into, is teaching you how to do that. And it's pretty simple, actually. And so that's even more so why I wrote, and it's a small ebook. That's more so even why I wrote it, because I'm just like, look, just do these things, and you will be in a much better position than a lot of other people that are just finding out at stage 4 all of a sudden that they have kidney disease.
Right. Yeah.
Mm-hmm.
I love that. I love that question so much because actually I just had this thought. I was like, if if all of the naturopathic doctors that I've asked this question to, we actually had our commercials on TV, like what a beautiful
Right.
world that would be.
Oh yeah, yeah, yeah. It would be
Yeah.
a big deal, definitely.
Yeah, it'd make a huge difference in the health of the community at large, and not just the few that we are able to reach out to.
Yeah, and I want people to start asking more questions of their doctor, right? It's not like you just kind of have to take what they say and everything, and I want them to have more urgency to understand what's going on. Again, like even though sometimes it's not always, I think, fully communicated or effectively communicated, it's sometimes it's like the doctors are like, "Oh, you're okay, you're fine." And they'll keep doing that through like stage 1, stage 2, stage 3. And then when you're at stage 4, hey, got dialysis. You need dialysis. So
Yeah.
yeah, that's
Yeah.
another reason why I don't want this to be like this shock anymore for people. You can be more aware of what's going on.
Yeah. Aware and proactive with your own health.
Yes, definitely.
Love it. Okay, well, thank you so much, Dr. Miles. I really, really appreciated having you on the show, and definitely hope to have you again soon.
Thank you. Thank you for having me. I enjoyed it a lot.
Thank you. I hope you enjoyed that episode with Dr. Miles and now have a better understanding of why it's so important to love our kidneys and take care of them. I'll have Dr. Miles' information, her book information, and the resources she mentioned in the show notes below, so make sure to check all that out. But that's all I got for you all today. Remember, you do have the power to take charge of your own health. So I'm wishing you all Mahan Health and sending you all love and peace, and I will see you next time.